All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So this is a chit chat, random questions. Let's do that. I want to quickly show you Dr. Samit Kisare's cat. So he's an Egyptian cat. His name is Catty, and he is usually also in the audience when these talks are happening. And I think loves to interact with Luffy as well. So this is the quick Catty. Okay, so let's see if there are any questions here. How is everyone doing? Yes, I love this guy. Hello, everyone. And Jim, how are you doing? Catherine, hello, how are you? Algebra Bean said, I read that study and understood it pretty well. Very good, Algebra Bean, you're awesome. Keeping up with the studies. Emily says we missed the discussion before. Emily, quickly, the discussion was a study, large study, about 200,000 total people in it from Qatar that showed that the reinfection can happen, but the efficacy of infection and then recovery, so the protection is 95%. The efficacy is 95%. So that is a significant efficacy. The message of the authors was, for 7 months, we saw that the protection of a person who was infected and then recovered kept going up or trending upwards, one. And secondly, they thought that they don't need vaccine. They didn't write it this way. They said, prioritize the vaccine for those who are antibody negative, meaning who didn't have an infection. So in my opinion, this is a very important study to combine with yesterday's discussion of saying we have long-lasting immunity. So with that, we have a proof now that there is actually protection after the actual infection. So that is a discussion. I hope that catches you up. So was that a preprint or published? Let's see. I actually closed it. 1 second. I will open it again. So published April 27. Information for authors. It does not look like a preprint to me, but it may be. I just, at least over here, there is no flag that it is a preprint. And this was published on May 1st. So today is June, so about a month ago. Reprints. I was trying to see if they have anything here. I don't see it. So we may be able to see it later, Doug. Okay. Emily Wiggins says, Bruce Patterson confirmed that long COVID is a vascular inflammation and endotheliitis caused by the presence of COVID protein. Will this issue resolve on its own? He suggests ivermectin and miraviroc. So good that he has disclosed what he has found. Interestingly, clinically, we had been managing for this with ivermectin. Isn't that interesting? So that means my long haul protocol that I wrote for FLCCC stands without much changes. Dr. Yo from Patterson's team now has participated as well in the long haul, and they had Bruce and Dr. Yo had suggested miraviroc. So we have added that. But this is what spike protein ivermectin works for. So I'll give you how my thinking was before this. And I'm happy that my thinking was on the right line. Some people would get back the symptoms after steroids. That would mean it is not just the immune system dysregulation. There is something else that is bothering it. Now, what is bothering it, what is something else, is not known. If we say that the virus continues to live on, that means the person becomes a carrier, and we were not seeing any evidence for carrier state. Ivermectin's function is more to do with the spike protein, because the rest of the virus, the RDRP of the virus, the cargo of the virus, to use in protein alpha and beta, the 3-chymotrypsin-like protease enzyme of the virus, if the virus is not there, then these enzymes are not there. So then the only thing left will be spike protein if ivermectin was working. So I was saying that in my patients, ivermectin was working. So that means there was a strong tendency that there was something to do with the spike protein-like things. So good to know. Now, to answer your question, yes, what we are seeing is that this would go away. Why would it go away? Because these cells would recycle over time. So these may become memory cells with the spike protein and sitting in the bone marrow and just continuing to do low-level activity and bothering us. But eventually, they have to become cleared out as well. That is one. And the second is we could give medicines to clear them out as well. I think that with this information, the right way to manage will be to combine steroid with ivermectin. Ivermectin would go and take care of the remnant spike protein pieces, and steroid would calm down the immune system so it does not replicate and continue to produce new cells with the copies of spike in them, and that would clear it out. So that is, I think, how it would work. Maraviroc, I do not know exactly the function for SARS-CoV-2. We know that for HIV it has a function. So that I just have to kind of think a little more about it. It's a good question. Okay, so Arun says, antibody test is more complex than vaccination itself. It will exhaust the resources of a country. Is it right? There are many ways to do antibody tests. For example, you can do pooling and then testing. For example, in the US, what you do is you take the blood and put 5 people's blood together, parts of their blood, and then do a test on that. If that comes back, then one of these 5 have. If that comes back positive, then one of these 5 has the antibody positive. Then you do one by one for all 5 of them. If it comes back negative, then all of 5 are negative, and you just say that batch is clear. But you're correct in general that yes, this testing, this is an extra logistical process step. This is an extra step to have resources and so on. So yes, you're correct. Luis Grande says, I saw FLCCC's video was pulled. Do you have a backup plan for ivermectin police tech guards like Odyssey or Rumble? Yes. So far what I've done is, since YouTube took down 54 of my videos monetization, and they brought some videos down. Since then, I have started taking every day a backup. So after these discussions, what I do is I go and I take the backup. The only thing is I do not take the backup of the chit chats. I take down the other ones that were not take down, but take the backup of the other concepts, so that if needed, we can just put them up somewhere else. And it is interesting. I'll tell you something. I'm keeping it under wraps, but now I'm going to share it with you. I have one more channel. I think you are all aware of it. And that also has ivermectin related videos. On this channel from where I'm speaking right now, 54 videos that have somehow connection with ivermectin. Either I'm talking about the mechanism of action, or I'm talking about some studies of it. I'm talking with Dr. Paul Merrick or Dr. Corey. 54 videos. Or other things, culture scene and others. So they brought down their monetization, which automatically kind of strangulates the video, because their algorithm says, I'm not going to earn with this video. Why should I show it to anyone? So that is a way to kill a video without admitting that we did it. So the message on the video says, after manual review, we have determined that this is not a suitable video for advertisers. In the other channel, So far, all videos are monetized. And the email that I received was after a manual, because one of them didn't was not monetized, and I appealed it. And I received the message that after the manual review, we have determined that this video is suitable for all advertisers. And the video is, guess what? Ivermectin, how does it work, and dose. So they are not consistent. And it is working in my favor that they're not consistent and those videos are up. But I am ready at any time. They can bring these down. India says, just made a marvelous Indian flatbread naan. Awesome. I just buy naan from a store and then just warm them in our grill. But making naans is great as well. I have a tandoor of our own, so it is out in the backyard. William Goff says, so could a person use that study to hypothesize that if a person was to get only one vaccine instead of two, that one shot's efficacy would build and also not decrease in time? Ideally, yes. If you use that, the question only is how much is the dose. So the answer you're already saying, get the test done to see what is the antibody level, and if that is kind of, maybe get the test done over a month, beginning of the month, end of the month, and see if the titers are going up or not. If they are, then you're fine. And secondly, important thing, please realize, I had done this discussion yesterday as well. I'm going to do it again, that it is not necessary that titers are always up. It is possible that in the beginning titers are up, then they decline, and then there is a baseline. So if, let's say, you are in this baseline window, then you would not expect huge titers, and you should not become worried about it. That is where the T cell test is useful. So short answer, yes, but the testing should be done. So there is somebody I'm going to block who is putting spam here that some doctor cures something. So I'm going to block you right now. It's just so weird. People do this. Okay, so M. Gregory. Question. The doctor who died in Tennessee got myocarditis from vaccination. He had asymptomatic COVID few weeks prior. Is there a link? Possible, yes. So again, not seeing the pathology itself, whatever I'm going to say is a conjecture, a hypothesis. But yes, let's say I got infection today, symptomatic or asymptomatic. Asymptomatic simply means my immune system was able to handle it before it caused enough damage that I developed symptoms. That's it. But immune system did put up a fight and took care of it. That also means that immune system is ready. And so now if a few weeks later I got vaccine which pokes this immune system a lot, then immune system could respond a lot as well. And that could happen. But then the question is, will a natural infection after a couple of weeks cause a similar outcome as well? I don't know. So if not, let's say natural infection will not do it, then it is not vaccine's spike protein issue, it is vaccine's adjuvants issue. And I saw a super chat. I think it was Roman. Roman, thank you very much. So Roman, something wrong with my computer again today. Thanks for your dedication to us all. Did anything come of your 501(c) effort? Just curious if you mentioned it and I missed it. So Roman, I actually talked with my accountant. He said, I am not recommending it because of the other businesses that I have. He said this is going to create a more... I think he was not comfortable that it would cause confusion, maybe more work for him. So he said, don't do it. And so I stopped. Maybe I should do it, but this is the update. Artless Calamity says, evidence is mounting that infection confers strong immunity. for patients who have good recovery, strong immunity for patients who have good recovery, okay, is this different for those who may have dysfunctional immune response, that is long haulers? So that is a good question, that a person who recovered in a healthy way, they have, as we can see, continuing to have a good immunity and would stay protected. Now, what about those who are long haulers? What about those who became severe in the first place? What will happen with the next one? So we don't have data for that. So I can talk from a mechanism point of view. From a mechanism's point of view, we are seeing that in about 20% of the people, long haulers, vaccines are actually helping. Why are they helping? Imagine if it is the spike protein remnant, as somebody was describing, Cool Bean was describing a few minutes ago by Dr. Bruce Patterson. So if this is a spike protein remnant, then giving a vaccine may cause immune system to kind of be triggered again and kind of clean out the cells that may have remnants and expressing those remnants on their cells. In some people, it would not do anything, or it might even cause a reaction. Now, those who have dysfunctional immune system, they may need vaccine if their own immune system is not working correctly. So you are correct. But again, exactly who are they? What are the conditions? I do not know. But they may need vaccine. So I saw a question about booster injection. So I'll go look it up. Let's see. Jodie's question is, I saw a video on YouTube about a cure in a town in India, some kind of eye drops. What is this? So somebody sent me as well. I did not watch it. Eye drops cannot do it unless they are vaccines. Because if, let's say, I'm protecting my eyes, how about nose and throat? And if they're saying that, hey, we're going to give you an eye drop that would cause then the tears, which has the drop in it as well, to go in the nose and then wet the nasal surfaces and then the pharyngeal areas, that is just a very far-fetched idea. Now, is this a vaccine? Is it causing the immune system to start reacting? I would hate to put it in the eyes if it is a vaccine. So I have not seen it, but it didn't sound a very wise thing to do, but I have to read it. Okay. BBQ Bean says, T cell test is negative. Could B cells be in bone marrow from illness in January? Yes. So it is not necessary that the T cell always have to be positive or the B cells always have to be positive. If somebody became infected and was able to be recovered in a healthy way, they do have their system ready. So T cell, if it is not positive, that is fine. They may have their T helper 2 pathway, and that would be B cells. Really? Al Cunningham says, Ivermectin eye drops? Maybe, but they would not work like this. Ivermectin needs to be absorbed and then go into the tissues. Doug says, does a positive T detect mean anything about cytotoxic immunity? I believe that the positive T detector T cell test is looking at helper cells. If it is looking at helper cells, memory helper cells, that simply means it may be T helper 2 or T helper 1. We do not know. So that would not say which way the immunity is. Good question. Grace says, can you please recommend your best videos to understand immune system for a newbie? So if you can tolerate my 10 years old videos where I have even thicker accent and a little younger, then it is said that my immunology videos are world's best. So in the same channel which you are on right now, there are some playlists, or if you go to the channel's homepage, there are immunology videos. And the first 2 or 3 videos would help a lot because I've done the overall bigger picture of it. So Arun says long haulers and cyproheptadine. It may be useful. So if you ask Dr. Fareed Jalali, he thinks that everything is related to serotonin, and of course, then these drugs would help. So it is worth a try. BBA Ra says, nice name. Dr. Bean, please share which vaccine did you get? Thank you. So I got Moderna. I actually put some videos up as well when I got the vaccine. So Jodie is saying that I think old infections will not have antibodies in blood, but in bone marrow instead. So not antibodies, but the B cells. There may be a basal level of antibodies present in the blood as well. Good question. Good comment. Texas Meg says, Christine, so this is a side discussion. Still miss naan to the kulchas. So I was talking with my tech team. Half of them are from India, another half are from Pakistan. So this morning I was talking with them, and they were saying, so we were talking about the breakfast and naans and kulchas and niharis, and they were saying, come over, we'll have it. Okay. Roman says, I found out that my mom's co-worker's relative, 29-year-old healthy man, got clot from J&J shot. He died 3 days after the shot. Nobody told him about anything to watch for. This is something that I've been trying to talk about for months. The result of this, trying to talk about this, was that I got beaten up a lot. But still, I thought I had some videos out. But I have also seen that my message does not become widespread, and maybe that is because these are longer videos. But this is a sad thing. Emily Wigan says long hauler suicide rate is rising. I wish more doctors were offering help like Dr. Bean is. Yes, and not only long hauler suicide rate, children, youngsters who are in lockdowns, their suicide rates are going up as well. So both of these communities are a lot at risk. Long haulers is a, so hopefully the long hauler protocol would come out in another day or so, couple of days maybe, and then hopefully we'll start better management. I am happy after hearing this from here that Dr. Bruce Patterson said that there is a spike protein in the cells. So I'm happy that original long hauler protocol that I wrote, from clinical side, that is what was the observation, that ivermectin, steroid, and Maraviroc I didn't try. Maraviroc and some other things had worked. So that is in there. Deb says, so folks, cool beans who are new, cool beans, when you ask me questions, please make them a little hypothetical, because giving a direct answer or direct advice, as much as I want to, so that I can help or assist you, at the same time, it is risky for both of us. Deb says, my son is PICVID and has had post-viral autoimmune encephalitis and cannot receive vaccines. Will the immunoglobulin product created from plasma donated from those vaccinated create an issue for him? No. And he can take monoclonal antibodies as well. He can take other things that we've been talking about, like ivermectins and other things. So no, he should be able to take them. I like this cool bean's name. His name is, or her name is, Questions for Bean. Patient with bilateral numbness ascending from bottom legs. Okay. Slowly creeping up to abdomen over 5 to 8 weeks. So numbness is moving upwards. with recovering sensitivity, but still numbness in bottom legs, not COVID thoughts. This could be autoimmune disorder, which is causing myelin sheath damage. It is a common issue. And this could be triggered by viruses. And the answer would be, I'm hoping that the doctors are giving steroids and those kind of things to keep the autoimmune system or immune system under control. Nipa Gandhi is here. Nipa is saying, I think you're talking about the Ayurved in Nellore, Andhra Pradesh, eye drops and oral medicine. No idea. Maybe. Bambi says, I've not watched 10 years old videos. I will do. So it may be interesting to see this at my very first video. Maybe that should just be a little homework if you would like to do, any of you. My very first video on YouTube is, I had a camera, you know, those Sony cameras with tapes in them. 10 years ago, I had that camera. I was holding it by myself. I was looking into the eyepiece. And then with the other hand, I was drawing on a piece of paper, and nothing was working. And the camera was shaking and the drawing was not working. And I wanted to use crayons to make colorful drawings. So it was a mess. But that was my first video. And I still remember I was going to make more videos in that manner. And a student who watched this put a comment, you can do better than this. So then I started thinking, how do I make it better? Then I made a studio. Those videos that you would see 10 years ago, many of them were in my garage when I was in Massachusetts. So in my garage, there was a place, of course, in Massachusetts, we have snow. So you usually want to put your cars in the garage. So I had put a board on a wall, and whenever the cars are not inside, I would sneak in and do some lectures. So that is how I used to do it. These are garage videos, correct? Doug, you're correct. Lizzie says, is ivermectin being used on ICU patients on a ventilator? It can be, but not. So when I consult with someone, I give them ivermectin at all stages, but generally not in the hospitals. Meaning not, I'm not saying it should not be. Hospitals generally don't use it. David says, Dr. Mubin, could endothelium health of an individual work for prophylaxis of COVID-19? Yeah, so if you keep endothelium healthy, it won't be a prophylaxis. It would just be a protection from something becoming serious or severe, COVID becoming severe. So the way to keep endothelium healthy is, number one, keep the reactive oxygen species down. Number two, keep the cells like neutrophil, platelets, and others at bay. Number three, keep the anti-inflammatory things in your body, for example, aspirins and other. Again, don't do it without your doctor's advice, because blood thinners can cause bleeding. And then number four, anti-inflammatory. So these things together can help. James, thank you very much for the super chat. I didn't see France today. Is France here? Question for Bean. Dr. Bean, medical X is persistent for 5 months. Varying numbness could be from allergy or malnutrition. What would be more likely? Some recovery of sensation. Malnutrition will be a very difficult thing, especially, so I'm assuming that the person is here in the US, for example. So malnutrition is only possible in the areas where malnutrition is, where it is difficult to get good food or normal food even. So if it is an area like that and there is malnutrition, then sure. But immune system issue is one. If not that, then nervous system, for example, multiple sclerosis type things. But they don't do this kind of a symptom set. But there can be myelin sheath attacked by the immune system, creating this kind of a symptom set. There can be uncontrolled diabetes, which causes the blockade of the blood flow to the nerves, which in turn causes the nerves and parts of the nerves to start becoming damaged. There could be the spinal cord and the compression of the nerves, or the incorrect pinching of the nerve, just like nowadays I have with my hand. So there can be so many reasons for these symptoms. So without seeing the history, without seeing the images, without seeing the labs, it is difficult to postulate. Skyfrog says, too late to join the fun? No, not at all. Today somehow my computer is just, some days my computer becomes just laggy, other days it is fine. So today it is a little slow. So when it becomes slow, I become slow as well. Yeah, where is France? Where is Margaret? There she is. Hey France, how are you? Okay, so Grace says, Dr. Bean, my cat Biju, who opens doors, sends greetings to Luffy, a fellow door opener. Thank you very much. These two guys, the Luffy and Kyrie, once scared us. What happened was they had learned to jump up and pull the door handle down and open the main door. So one day in the morning, we woke up and we saw that the main door was fully swung open, and both of them were sitting at the door just looking outside. And so we then added one more lock, which could not have a handle. It was more of a pin, and that is how we contained them. So they are quite expert with opening doors. So good that Biju does that too. You should send us a picture or a video. Priya says, you are lagging, sir. I know I'm lagging today. My apologies. I have no idea what happened today. Joy says, is it safe for a 90-year-old to take vitamin K2, and what are the side effects? Vitamin K2 is actually good because it helps with the calcium metabolism. So it is generally good. The question is how much and with what things. And so it should be fine if you take in the daily RDA. So so I had requested the Cool Beans not to ask me direct questions for a person, but here they are. So not talking about any specific person, which vaccine in your opinion is best for 55-year-old man with diabetes? So I had done this discussion before as well. Look, all of these vaccines have now something or the other that we are seeing. For me, the best would have been Novavax, although those who are waiting on Novavax, imagine if the Novavax has spike proteins that are sitting in the interstitial tissue and we are all scared about the spike proteins, then that Novavax can be bad. But we have to see the results. On the second, I like messenger RNA-based vaccines because they are not as invasive as adenovirus-based or DNA-based vaccines. Plus, they do not have the adenovirus as itself another virus against which the immune system can start working. Plus, their adjuvants are not like adenovirus-based adjuvants. Their lipid nanoparticle itself is the adjuvant. So because of all those mechanisms, I like messenger RNA-based vaccines. I feel that they are better and they are more light on our body. So my first priority would be to get Moderna. I got Moderna or Pfizer. I got Moderna all by accident. I didn't mean to go there and ask for Moderna. Then are the other ones. So generally in men, it is okay to have any of these vaccines, inactivated virus, adenovirus, messenger RNA, but diabetes has to be under control. So that is important because it is possible that the immune system just becomes derailed and they might get severe symptoms. So just have diabetes controlled. Okay, so this is why you brought up the malnutrition. So yes, so then in this case, 30 pounds in 1 month, did you do their cancer profiles and continue to lose 100 pounds of additional 3 months, which is what brought up. So it is not just the malnutrition. So please get their profiles done for cancers as well. Or do they just not eat? I mean, are they not provided the food? One is that the patient is not taking the food. The other one is that food is used up very quickly by cells like cancer cells. So please get their profiles done. Abdullah Musa says, today UK revealed new study shows Pfizer only has very small amounts of antibodies against Indian variant. Can you have a look at this and tell us what they mean? It was the main headline in UK. Okay, so let's see what are they saying. So Pfizer vaccine Delta variant 12 hours ago. It says COVID vaccine Pfizer jab recipients have fewer antibodies against Delta variant. I need to see the study itself. A recent study found that Pfizer jab recipients not only had almost 5 times fewer antibodies to protect against the Delta variant than the original strain, but also that these antibody levels decreased with time and age. That does not sound right. So let's think about it. Again, this is what happens when I'm looking at the studies. I first have to be wondering what is this that they're saying, and then read the mechanism and understand what they're saying. So now with the study, let's see what the study is. Maybe the study is here. So they're saying neutralizing antibody activity against SARS-CoV-2 variant of concern 6172 and B351 by BTN vaccination. So they are talking about South African variant 2. So they're saying the efficacy of currently licensed COVID-19 vaccine against B6172 is unknown. Okay. 12 mutations in spike protein relative to wild type. Okay. Escaped by 7.2 and compared activity with previous strains with existing estimates of population. A detailed description of the method. I want to see the results, so give me 1 second, please. Do they have results written in one place? These data, together with epidemiological data of 6172 growth, raise the possibility that this VOC represents a dual challenge of reduced vaccine efficacy akin to the 351 and increased transmissibility like 117. The impact of such a change is challenging to predict. So we don't even know if the concentration that is reduced or is less effective, how less it is. Is it instead of 100, it is 80? And then they have this statement here that we actually don't know what we are saying. Effect is difficult to measure, but it has the something looking like South African variant and something looking like UK variant. So we have a problem. No, it's not necessary that we have a problem. Confirming reduced NAB activity against 6172 relative to 117 strain, that we should actually expect because we are already seeing that the 6172 is more efficient. That is because our bodies are not able to handle it that well. So, of course, the antibodies will not be able to handle it that well, which are against the 117. But let's see. Strain after one vaccine dose, notably against relative to present strain after one vaccine dose. One vaccine dose is not a bet anyways. Notably, participants with low neutralizing antibodies tend to be older than those who produce medium or high responses, which is generally true for all vaccines. And logistical regression analysis suggests age is significant. So is age the factor or the variant the factor in reducing this independent strain in our example following a single dose of this? And then it is a single dose of BioNTech. We have 2 doses. So maybe they're trying to say to UK that, hey guys, you have a large gap between the 2 doses and the first dose is now less efficacious. So maybe give the second dose faster. maybe that is their intent to do that here. It does not look these data together with epidemiological data of 6172 growth raise the possibility that this is a variant of concern presents dual challenge, reduce vaccine efficacy, which all variants would do. Reduce vaccine efficacy and increase transmissibility. That is what South African variant did. That is what UK variant did. That is what Manaus did. So the impact of the question is how less. And maybe I have to read this whole thing to understand that. The impact of such a change is challenging to predict. If they knew how less and how badly impacted, they would have written it here. It remains difficult to assess precisely to what extent the reduction. Hey, Luffy. Luffy, what happened? Come here. No? Why? You want to go out? Okay. So the impact of such a change is challenging to predict. It remains difficult to assess precisely to what extent the reduction in neutralizing antibodies we observe will impact vaccine efficacy. So they themselves are saying we do not know what is the impact. An increased disease severity in vaccinated population, especially given the multiple factors that contribute to this process, such as long-lived humoral immunity. So, Abdullah, as much as there is something here, their own message does not even quantify the impact. They're saying something would happen. That we know that something would happen. We don't know exactly what. So I'll read it, but it doesn't look very scary to me. Looks like media just love to take these things and work with them. Steely Dan says, I got the shot. Now I wish I didn't. Why? So if you had the shot and you're okay and you're here, then you're fine. Luffy was here. Okay, so I'm just trying to see if there are more questions. Simple Garden says 92-year-old mother and SIL's 100-year-old mother, both Pfizer back. Okay. Both Pfizer? Okay, I'm just looking for the questions. Anna Strange says, does vitamin K2 affect clotting? Usually vitamin K1 is the one that has more impact, but still it is the same family. It can. This is why we should not do it in the people who have bleeding disorders and the people who have calcium metabolism issues. So this should be properly seen, observed by the doctor. Alfred says, sounds like a scary story to boost vaccination. Yeah, they themselves are saying we don't know what we are saying, or we don't have a impact analysis. The fun will have been that if they came out and they said efficacy is now down to 10%, and we think now we have a problem. Then looking at the data and seeing if that is a correct thing or not would have been. Here they themselves are saying we don't know what would happen. I haven't seen Samina for some days. So, okay, so Nipa has a question. So, question for Bean. This cannot be resolved in the questions here. This need to be looked at by a doctor, see why they have, if this is a bulimic issue, then they have to look at psychological aspects. This is not something that I can solve here without really knowing the whole thing and without having that patient being my patient. Nipa Gandhi says, Question: we had taken Covishield in February. Covishield. So the Covishield is the AstraZeneca, right? With 28 days gap. Now they're giving it 84 days. Do we need a booster? If yes, is Covaxin Indian better? So Covaxin is the inactivated virus. Covishield is AstraZeneca, Oxford adenovirus. If you did not react negatively to Covishield, then you can have the next one as well. At the same time, original studies had administered this vaccine with 28 days gap. So after 2 weeks of the 28 days, you have full protection with 95% efficacy. I don't think that UK showed any greater efficacy after a greater gap. So I don't think you need that. But if you took it and if you had not reacted before, then your body is going to just not bother. It will just say, fine, thank you. I will train myself a little more. Andrea says, my cat came in talking and yelling back at Luffy. Luffy just came in. Luffy must be telling Kyrie that, hey, I went and yelled at Dr. Bean. Neri says, does Covavax use the spike protein? Novavax, you talk, right. So yes, Novavax has the spike proteins attached to a lipid particle, and that is what the vaccine is. I like that from this point of view, that there is no messenger RNA, there is no DNA, but there are spike proteins. Nipa says, thank you. You're very welcome. Big Natty Brubs says, some people are reporting arm and injection site pain months out from getting messenger RNA vaccine. How could the shot cause that? Could it have poor training in the administration? So it could be a shoulder damage, which is a consequence of incorrect vaccination. Otherwise, after months, having a vaccine's local side effect is not possible, unless, for example, the vaccine caused damage to the nerve or the blood vessel or other ligaments. Then it may be administered incorrectly. But vaccine is not going to sit here for a month or 2 months and then cause local damage. So Abdullah says, question, yeah, all you can use channel just hyped this up saying we need boosters, yet only 1 week ago they were saying Pfizer was 88% effective. So this is not a question, this is a statement, Abdullah. And yes, you're correct. This is what they are doing. I was thinking today when I was talking about this study, I was preparing for it. I think one interesting thing that we did, Cool Beans, was that we kept fending. I was thinking of us all in a big caravan, and we have our shields up, and we are not letting these arrows come and hurt us. And these are especially amplified by media because it gives them money. It gives them more ad revenue. It gives them more traction. It gives them more clicks, and they earn with that. So they would rather have more of such news that they can then use. We had been doing. So please don't mind, folks from UK. There is a person from UK who talks as well, and much bigger voice than mine. But in the beginning, I watched some of his videos, and it was just so fear-mongery that I have this video today, and I think that this video will be I never thought in my life I'll make a video like this, and here is these in Africa, this is what's going to happen, and 23 million are going to die, and this is, I'm really sad. So this is the kind of messaging that started, and that actually causes traction. We over here kept saying, let's be reasonable, and let's understand what is happening and what is wrong in terms of fear and what may be concerning. And here we are. We are almost at the end of pandemic, and we have successfully reached here so far, while keeping ourselves relaxed. So I'm pretty happy about this, but this works for media and others to get some more clicks. So Abdullah Musa says, Dr. John Campbell promoted your channel a few days ago on Ivermectin. Very nice of him. Grace says, Does taking ivermectin interfere with immunity development if you take it early on? Does taking immunity development? So, Grace, I wanted to talk about this. So thank you for asking this question. And again, this talk that I'm going to do now, maybe it would be hidden in this chit chat, so not many people would notice and I'll be okay. But this can cause a lot of YouTube pushback. So let me explain something. And listeners have to promise that they would not use this because this is just a hypothesis. This can cause damage. So please don't use it. This is a hypothesis for learning, educational point only. So look, the ivermectin's outcome on a person who's taking it for prophylaxis and correctly taking it. Let's say here is a cell. The person is taking ivermectin. Actual virus arrives, right? First thing, and we know the function of ivermectin, I've done those many times. First outcome is ivermectin gets stuck to the spike protein, which then causes a delay or reduction in the infectivity. Correct? Second, inside the cell, we know that ivermectin would disrupt RDRP. That would also delay and reduce and stall the production of new cells, viruses. It would also impact 3-chymotrypsin-like protease, which would also reduce the newer virus generations. It would also disrupt the importin alpha and beta, which would also make the cells stronger against the virus. Then it works with the nuclear factor K beta, can I know how to write it? Nuclear factor K beta. So that is some inflammatory modulation. So think about it with me. Virus arrived. I'm going to say something that I'm hesitant to say it, so please don't take it. This is not an advice at all. Virus arrives. Ivermectin is here. Ivermectin is stalling the virus. Meanwhile, don't you think that the immune system is becoming ready to kind of pick it up, the virus, and start killing it? And so the virus is not able to do too much damage, but immune system is going to start responding to the virus. So from a mechanism point of view, I'm being very careful. From a mechanism's point of view, we will develop immunity with possibly less severe outcomes of the infection. So your question, Grace, that does taking ivermectin interfere with immunity? No. Actually, it helps immunity by interfering with the virus and allowing the immune system to quickly take care of the virus. That means ivermectin can actually be helpful in helping produce this immunity, which is long-lived immunity. And I think you can read between the lines that what I'm saying is kind of serious. We'll see. If you don't see my channel in next days or so, just reach out to me through phone or something. Okay, so good question. And yes, please, let's. Yes, so Roman, I'm going to quickly. Roman enhances immunity. So correct. So it does not have direct effect on the immune system itself to enhance it, but it allows the immune system a relative enhancement. That virus is not going fast now. The enemy is not increasing in number, but our defense can increase in number while ivermectin is holding on to the enemy. And that is a relative amplification of our system, and that can take care of the virus quickly. Not only that, but then immunity would be developed too. So I was thinking about this for weeks, that ivermectin can actually be something that can allow people to develop immunity in a good way. But, okay, so question. Alfred Chow. Question, but blocking replication reduces the dosage of the virus. That is fine. Look, the thing is our immune system does not need a huge amount of dose. Think about the vaccine. Vaccine is 0.5 milliliter, tiny bit, and that is sufficient for the immune system to respond. So even when the ivermectin is stalling the virus, it does not neutralize it, it does not sterilize it, it does not kill it. It's not contrary to many doctors saying that ivermectin is antiviral. It is not antiviral. It is virustatic. Immune system is antiviral. So it allows the immune system to respond better. It allows our defense cells to respond better. It allows our cells to have interferon alpha available to shore up their resources, which means our immune system would become better. So it is actually not against our immune system. It is actually an enabler while keeping the enemy down. So Luis Grande says, does Lancet regularly print articles about general, already known immune concepts, older versus young, only 1 shot or 2 shot recommended dose, less efficacy with variant? This is not news. So, of course, I think this was a rhetorical question. The whole immunology, the whole science, the whole reporting of the science has been reinvented in the last year, where these media folks could figure out ways to scare us the most. And we had no idea. Still, I believe those folks. So there are group of people who say vaccine is really bad. Group of people who say we should take vaccine. Group of people who say ivermectin people are wrong. Then there are people who say ivermectin people are right. If you ask any group, eventually they're trying to protect themselves. None of the group, all of these boxes, none of them is actually coming out with the intention to say, I don't want to protect myself. I want myself and the others to be damaged. They are finger pointing at each other to say, you are going to damage people and you are going to damage people. But this is what these media and big companies, they took advantage of. They were not merciful to say, people are stuck, humanity is stuck, let's be good for some months. They took advantage. They're still taking advantage of it. Look, NIH is saying we have found a drug. I looked at their drugs, that paper, the page, and the drug is a disruptor of RDRP of the virus. Well, we have ivermectin that is a disruptor. Why did you find a new drug? So everyone is taking advantage of this thing. Roman says, bam. Roman, was that a response to some of my discussion or somebody else said something nice? France says, nice. Okay, so let's see. So, question for Bean. Dr. Bean lectures, okay, thanks for you, but patient won't get to go to get labs due to fear of COVID. If receding or staying the same, would one assume it isn't autoimmune? Wants vaccine but afraid of. This is a psychological thing. So even if the patient does not go to do those things, my recommendation is, this is what I do for my patients. Ask a doctor to visit the patient or have a tele call. Get psychological help first and then the rest, so that they can start thinking a little bit more balanced, and then they would start saying, okay, I can go out for labs, or I can take more food and so on, and they'll start recovering. It seems to me from what you're saying that they need psychological help first, and even in that, psychiatric help, so that they can have medicines to quickly bounce back. Jerin says, sir, how medical field should advance so that we can prevent another pandemic, which may come soon, and imagine if it's more deadlier virus than COVID. So generally, medical field has already advanced a lot now because of this pandemic. As much as there is a lot of media and alphabet companies taking advantage and big pharmaceuticals taking advantage, there are honest to God research workers. There are people who are doing, doctors who are doing doctoring, and they are doing a lot of good research, and there is a lot of advancement that we are seeing. Now, can we prevent next pandemic? I think that I was really hoping, so folks know from a US point of view, I thought we will be the best country in response. We actually were not. Then I had another hope that this would cause a lot of process changes so we don't get stuck in these kind of red tapes again. And I've not seen it. Maybe that would appear. So the countries which we sitting here in the US, we look at those countries and say they have less resources, or they don't have right processes, or they don't have good regulations. These countries came out on top because of all of those negatives that we talk about. For example, Dr. DeMello yesterday was saying people can just get the medicine over the counter. So I can just call them and say, take this, and they would take it. This is the same thing for Pakistan and others where I practice. That has become an advantage. So hopefully, after the pandemic, there'll be a comparison. There'll be studies to say a country that had less regulations and rules, they were better than a country that had more regulations and rules. So maybe our healthcare needs to be changing. So there are going to be more studies there. I think there'll be some. Eventually, there is going to be good that would come out. Random says, hi doc, can ivermectin be safely combined with corticosteroids to reduce inflammation, or with ivermectin alone should suffice? So no, combined with steroid. And this is where I'm happy that I had this position that ivermectin plus steroid, and you would see in the FLCCC's algo that you would see start ivermectin, add steroid. This should be combined. Ivermectin is anti-inflammatory. If you go back to my talks, I have always said its anti-inflammatory's function is not as strong as other anti-inflammatory. So if you were using ivermectin for anti-inflammatory outcome, then there are better anti-inflammatories. So there was a ivermectin's own outcome, and that was its disruption of this virus debris. So that means, depending upon what is the pathology, it may need to be combined with steroids. Skyfrog says, is there some country where medicine is investigated scientifically? So ideally, US and Europe and many other such countries which have advanced medicine, that is what they were doing. That is what in normal cases they do as well. I just think that during the pandemic, people became more busy earning money and extorting or something like that, people who were scared, getting money from them, and they forgot what was their general way of working. So $22.22 says, you've said previously that it's unlikely for spike proteins would circulate and lodge post-vax. Did you hear the podcast with Dr. Byram Bridle in Canada? He seemed to be citing new data, disturbing. I have been listening to him. I did with Alex, correct? There is a lot of... so listen to that again and see what he's saying. What he's saying is, we have gotten data from Japan. We have gotten data. Well, where is the data? Let's have the data. Other people write research papers and put them out, saying that this is all out in public. He's saying this multiple times, I believe. At least that was my takeaway and impression, that, hey, this data is out there. Where? So I know that there are studies from Japan that says that in ovary there may be antibodies. I have to look at that. There may be spike. But coming out with such sweeping issues, which you cannot see in general public. If you see, whenever you look at these scary talks, concerning talks, put them against the clinical observation of what is happening. Are you seeing a big, large wave again, for example, in UK? UK is, right now, everybody is saying UK got 6172, now they're in trouble. Are you seeing that kind of a way? If you're not, then at least balance out that what they're saying may not be true. They may have seen it. Let's try to give them credit. They may have seen it in some petri dish in vitro, but we are not seeing that in humans. Or if they are that much of prophetic that they can profess now and 2 months later and 3 months later would happen, then we have had those prophets from some time now. Cahill said in March, April, people would die, and they would die in thousands of numbers. Where? So, yes, I heard that because so many people sent it to me. I haven't looked at the data to say he's right or he's wrong. But when I listen to him and I put that against what is being observable, then that doesn't make sense yet. Phil Lee. Phil, I have seen you after a long time. Isn't the idea of vaccination passports against the Nuremberg Convention and therefore crime under international law? So, look, I am not very happy with the idea of the passports. So, I'm not someone who would say there should be a passport. At the same time, I'm also not clear. So, you think with me, there are going to be 200 people boarding on a plane. It's going to be a closed place where people are going to give each other the infection. How do you make sure that less chances of infection are? And you can take any position. For example, anti-vaccine folks say vaccinated people are going to damage us. So then they want to know that who is vaccinated. Vaccinated folks say anti-vaccine folks who did not get a vaccine can carry the infections and cause the spread. So now they want them to have the passport. So it is not that one group is saying there shouldn't be no passport. There is still that fight going on. So the question is, what is a solution? That, I think, is a more important question to ask than to say this, what they're doing is, it sucks. Agreed, it sucks. I would hate it when people would continue to. Remember yesterday, somebody kept asking me, which vaccine did you take? And some other invasive questions. And I answered a couple of those, and then I became a little defensive. And I said, I don't want to answer further. So how do we get this data so everyone, they have taken a vaccine, they have not taken a vaccine, they are immunosuppressed, they're not immunosuppressed. Everyone has an equal right on this, for their resources, their freedom. So how do we manage it? I think that is a better question to answer. Abdullah Musa says, did you see the study also showing vitamin D has no effect to make COVID infection severity? So you know that there are all kind of studies. I think one can give money to some folks and they'll create a study. Doug says, I just want to know if someone has smallpox. Otherwise, keep your health information to yourself. Good. Grace says, did you see that EU vaccination passport allows negative PCR or recovery from COVID-19 or completion of vaccination? I think this is reasonable for the safety and respect of all. And again, they will have to figure out some solution. We all will have to figure out some solution. Today, I went to Starbucks, and there were so many people. So Starbucks has opened up their outside. They have put the tables on the inside, but they say tables closed. There were a larger number of people inside as well. There were people sitting outside at the curb and taking coffee. So meaning society is opening up. So people are kind of relaxing, being happy. I was happy looking at them happy. At the same time, every time I'll pass near somebody, I would think, are they vaccinated? Are they not vaccinated? And even if you forget about that question, are they infected at this time? Are they in the window of 4 or 5 days of asymptomatic infection, regardless of they are vaccinated or not? And these are interesting things to figure out. How do we reasonably get past this all? So this is good. I think there will be more innovation needed. This probably is a knee-jerk reaction to say, let's just create passports, or this is probably is a lazy response. I see a lot of lazy responses by these folks, the leaderships. William says, hypothetical patient on a vent. A hypothetical cool bean Told family to use liquid ivermectin, DMSO to smear on legs. Do you think ivermectin plus DMSO typically would absorb for a desperate family? Sure, it will absorb, but not in the right quantities. Why can't they crush it and give it through the NG tubes? Bobo says, can statins anti-inflammatory effect work in reducing inflammatory response to COVID? Yes. And we have talked about it, and FLCCC or iMath had statin as part of that at some point. I don't know if they still have it or not, but we talked about it. There is a beneficial result of this. Texas is saying, Susan, you make too much sense. Very good. So Kelly says, I think some of what Byram Bridle referenced is in the Ogata study. So I have to look at this. So that is a continuous gap in my knowledge. I even have one of the cool beans sent me through WhatsApp the translated paper, and I haven't looked at that. So I think I need to read that before I can actually make any comment. So you can strike my comments and say, not good comments yet. Peggy Walker says, have you seen new research conducted in Japan shows that lipid nanoparticles containing the mRNA code are widely circulated around the body after vaccination, reaching the brain? So Peggy, here is the question. No, I have not seen the study. I would like to see it. But the question to answer is this, and it is totally understandable that the study would find this. Question is this. So let's say here we are. Here is a person. How much of the lipid are we giving? 0.5 milliliter? Is that sufficient to actually be widespread in the whole body? To be found everywhere? 0.5 milliliter. And then is that sufficient to say this is going to go into the brain and cause some damage? Is this a knowledge that we have that instead of, let's say, here in the deltoid, it goes to a muscle here. So it travels all the way from there and goes to the muscles of the legs. And then those muscles of the legs pick it up and create the spike protein. Is that bad? So there are these questions to be answered. The real good question to answer for lipid nanoparticle is, can that actually not enter a cell and just keep circulating and get stuck somewhere? Liver, for example. Spleen, for example. Or can it cause some other kind of illness? Most of the time, this is going to be picked up by immune system macrophages, dendritic cells. It would be converted to, it would have the messenger RNA that will make spikes and it would go away. 0.5 milliliter is such a small quantity that saying it is widespread in the body, difficult to say widespread. So you have some way to find it here and here and here and here, fine. It is in the blood. Is that sufficient quantity to cause any harm? That is a question. M. Gregory has a good question. Does COVID spread faster on a plane or a cruise ship? So give me the environment of these. What is their ventilation like? Are they wearing masks or not? Are they talking or not? What is happening? Do they have, distance between the chairs and so on? I may be able to then respond. So Fishtail says, Dr. B, did Dr. DeMello have both COVID and did he also take a vaccine? Why are his antibodies rising? He seemed so proud of that. So, of course, if he's getting more and more antibodies, he should be happy that, hey, I'm protected. That's why he was happy. I did not ask him. So I don't ask my guests, did you take a vaccine or not? And before they go live, I give them this message as well, that they can skip and pass on any question they like, my question or from Cool Beans, because there is a level of respect that we have to maintain, or I think I should maintain, when I have a guest. I'm not doing some investigational journalism to challenge them and say you're wrong or you suck or what. So I let them present their message, which can go to Cool Beans. I feel Cool Beans have enough information and knowledge that they can either discuss it with us together or they can make sense of it. So why was he happy? I'm sure that he was happy because he has antibodies. Now, did he take a vaccine or not? Did he? I don't know. Good question. Luffy, what happened? Chan says, you suck, Dr. Bean. Thank you very much. This is not news. Okay, so it looks like we are kind of run out of questions. Question from John: what's more likely to cause vascular mimicry attack? PEG, so that is polyethylene glycol in messenger RNA, or polysorbate 18 proteins and viral vector and adjuvant saponins. So I have heard all of them to be able to cause vascular mimicry attack. And let's start from here. Novavax, we still do not know. How would it do? And what kind of matrix protein how would that come out? We already know that adenovirus-based vaccines, or today I was reading that maybe it's not the adenovirus, but it is some adjuvant within the adenovirus platform, because there are some adenovirus vaccine companies, countries, for example, Sputnik, they're saying we don't get clotting. It's you guys, the AstraZenecas and Johnson & Johnson, and they're trying to help them as well. So maybe it is some adjuvant there, but we know that there is something with the adenovirus-based vaccines that are causing it, more than messenger RNA-based vaccines. Now we are also seeing that messenger RNA vaccines can cause it too. So from an observation point of view, you can see some vaccines are doing it more than others. Okay, so question for Bean says, thank you. One last question. If it is autoimmune or anything attacking myelin sheath, could hypothetical patient get vaccine without increased risk of GBS or transverse myelitis? The Guillain-Barré or transverse myelitis is not connected with any autoimmune issues. In some people, it happens just like some people have allergies. They may not have autoimmune issues, but they still have allergies. So we still do not know what triggers it. So that means, to your question, I can't actually answer it saying, yes, nothing would happen, or no, something would happen, because there is no connecting data yet for this. Artless Calamity says, do you think ivermectin may have efficacy for treating long haul symptoms? Yes. Or is it more so acute? No. So it is for all stages. Look, for long haul, if there is this debris present in the cells, guess who is going to work on that debris? Ivermectin. Ivermectin is going to be inside the cell and connect with this spike protein and help to clear this out. So ivermectin is, after this message that Bruce Peterson announced that, then ivermectin's usage has become even more important, and that means my long haul protocol that I wrote has become even more valid. So does that mean that this is the only pathology possible? No, I don't think so. There are other pathologies I'm seeing. William says, just curious, why do we even give vaccine intramuscular knowing it hits the bloodstream faster than sub-Q, when sub-Q eventually gets into the bloodstream also just much slower? We don't want it to go in the bloodstream. We want it to go in the cells. And that is why this area for cells is a good area. You can give it in other muscles as well. You can give it subcutaneous as well. We want it to go to cells. If you inject a vaccine in blood, now we have to wait for that vaccine to be captured, come out of the blood, or get stuck to the endothelial cells and cause local reactions there. And we don't want a vaccine to cause vasculitis. This is why vaccines are usually not given in the bloodstream, because we are targeting cells, not blood. Phil Lee says, after your earlier presentation, I would say that only an antibody passport would be legal and ethical. Would you not agree? So I was actually, it is strange that I keep saying I was thinking about it. The whole day when I'm preparing, I do think about these things. I was thinking today that how unfair it is for people to say, you have to prove you were vaccinated or not. If we can do antibody test or T cell and a person can prove that they have protection, then they have protection. Why do they have to prove I have vaccine? So I agree with you. So let's do this. There is one more question, so let's answer a couple of more questions. Paris says, what could be the reason for high pulse rate after recovering from COVID? My dad recovered after battling for 3 to 4 weeks. Still, his pulse is high. So yes, a couple of reasons. One is the damage to the cardiovascular system and the lung system and the demand of the body, and the system not able to fulfill that demand, maybe not doing enough oxygenation because the lungs are damaged, or because some vascular systems are not fully working, or scarring, or fibrosis, or congestion. So all of those can put burden on the heart, because if the body is not getting enough oxygen, it's going to ask the heart to work more to send more blood and send more nutrition and oxygen. So that is one. In Dr. Hector Carvalho's way, we would say that is a sequela. Then there is possibility of the long haul, in which the tachycardia can actually be a very common long haul symptom. And that could be parts where while let's say I'm sitting, I stand up and I have tachycardia to compensate for the gravity. That means my blood vessels are not vasoactive correctly. They're not becoming constricted correctly to maintain my blood pressure, and my heart has to compensate. So that is one possibility. Vagal nerve inefficient working is another possibility. And then MCAS and others, that is another possibility. Less oxygen is another possibility, which would then be attached with doing small exertion and becoming breathless and tachycardic. So there are all those possibilities. The most important solution, other than the ivermectin and steroids, is to not exert too much and slowly build your body back up. I heard this thing. France Lorraine, did Wayne die? I saw in the last talk, I saw Wayne had actually asked a question. He was here today. Jaren says, thank you, Dr. Bean, for replying. Dr. Najib and Dr. Bean are the best. Thank you very much. Cool. So there is one more question here from Louis. France says, no. Okay, thank you. I became totally disoriented for Skyfrog says I ran out of the question. There are others with the question. So Captain Tom says, my doctor wrote me a prescription for 5 tablets of Ivermectin, 23 milligram each, to be taken all at once. Why? 23 milligram each? So the ivermectin protocols are different for different stages of the disease. If it is prophylaxis, then 0.2 to 0.4 milligram per kilogram body weight once a week. FLCC says take one today, take one tomorrow, and then once a week. I just simply start once a week. So again, that is 0.2 to 0.4 milligram per kilogram body weight, one dose. Not, so what I'm hearing here is 23 milligram multiplied with 5 as one dose. That will be, unless person is really, really obese, that is a very high dose. Actual disease, keep taking for 5, 6, 7 days until you recover. Post-COVID, 5 days continuous and then weekly. Okay, so TD says kidding. Yeah, so you scared me. This is like, the classroom where there are some kids who are just doing their own little things and the teacher is saying, hey guys. All right, so there is a question. Let's answer this question as well, if I can. And then Doug says, do the vaccines with perfusion stabilized spike have fewer T cell epitopes? I think it depends upon the vaccine. For example, Johnson & Johnson said we have more T helper 2, T helper 1 pathway, we trigger more. So it really depends what is the vaccine's epitope structure they have. Question for Bean. If it's due to copper deficiency, myelopathy, and damage to myelin sheath, would that increase the risk of an adverse event like GB after vaccine? So look, if somebody has nutritional deficiencies because of which they are seeing these, so then these are not immune system problems. These are just the system's integrity issues. Then even if you give a vaccine is not going to do too much because immune system would also not respond correctly. And then it would not become too severe. It would be less symptoms because immune system doesn't have the right things to work with. Okay, guys, cool beans. There are more questions. We should do one big marathon. So my apologies. There are still more questions. Let's put them for Monday. So please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. You can buy me a coffee, or you can be a patron, or you can use PayPal to support this work. Thank you very much. Have a nice weekend, and I would see you on Monday.